So Jennifer and Peter, we're just going to wait a moment as people are being connected to the webinar room.
Okay.
Can you still hear us, Peter and Jennifer?
Yeah.
I can. Can you hear me okay?
Yep, perfect.
Great.
Okay, let's get started. So good morning, everybody, and welcome. I'm Brett Janelle, and along with my partner and wife, Annette Janelle, we have the company Janelle Moves Made Easy and the Janelle Realty Group. And we're here today with Dr. Jennifer Carson and Dr. Peter Reed from the University of Nevada, Reno. And today's webinar topic is COVID-19 Aging Network, or in short, CAN, which is something the University of Nevada, Reno, and Peter and Jennifer have been heavily involved in. And we just wanted to take the opportunity today to talk to them and learn a little bit more about what CAN is. So Peter or Jennifer, could you just start off by just telling us and the audience what CAN means?
Absolutely. I'll be happy to start. And Brett and Annette, thank you very much for inviting us to participate in this series. We're delighted to have this opportunity to talk about the work that we've been doing with our partners around the state. So the Nevada CAN effort, that's a catchy acronym that stands for the Nevada COVID-19 Aging Network Rapid Response. And this was launched back at the beginning of April after several weeks of intense planning as a way to mobilize and coordinate the efforts of aging service providers in communities all across the state of Nevada. And so our partners include the Nevada Aging and Disability Services Division, which is part of the group, the Health and Human Services Department at the state level. And then also Dr. Jennifer Carson, who is with the Dementia Engagement Education and Research Program at the School of Community Health Sciences. Jeff Klein, who is with Nevada Senior Services down in Las Vegas, and then myself with the Sanford Center for Aging. And so those four entities came together to lead the effort, but then Nevada CAN really engages and mobilizes all aging service providers in communities around the state in trying to create a coordinated effort to make sure that older adults can stay home as they're being required to do, and can remain home as this pandemic continues to reduce their exposure to COVID while maintaining access to the essentials of daily life, like food and medications, to social support to reduce social isolation, and to telehealth services to keep them connected to routine appointments that they might need. So the overall idea with Nevada CAN is to create a tool. And that's really what it is. The name Nevada CAN is just a name, right? Ultimately, this is a tool that has been mobilized by the state aging division and community-based aging service partners to ensure elders can stay home and stay connected so they can stay safe during this COVID pandemic.
You know what I find amazing is how quickly you mobilize this. I mean, since April, there are so many aspects of this that you have put into place to help so many people. Can you tell us why it is so important for older adults to stay at home during this pandemic?
Absolutely. So I'm assuming that everyone on this call has heard of the coronavirus. We'll just start with that. The coronavirus is a global pandemic that is spreading very rapidly. If you look at the data just in the United States, over the last 50 days, right, between, say, March 16th and today, we went from having about 4,000 cases in the United States to having 1.2 million cases. And we went from having about 40 deaths in the United States to having about 74,000 deaths. That's in less than 2 months. So this is a virus that is spreading very, very rapidly. And it's particularly consequential for older adults and people living with chronic conditions such as hypertension, diabetes, heart disease. These are the folks that are likely to have more severe consequences if they contract the coronavirus. And so I have heard data from epidemiologists that describe potentially as high as a 25% mortality rate for people ages 80 and older. but there's an elevated mortality rate for people ages 50 and older. And so just as everyone over the last 6 weeks has been told to stay home to avoid their risk of exposure, it's critically important that older adults and people with chronic diseases continue to stay home to avoid exposure to this disease for as long as possible until the public health and medical communities really get a handle on the continuing spread of this disease. As I said, to go from 4,000 people to 1.2 million in less than 2 months means it's spreading very, very rapidly. And there's a very high risk of exposure in our communities. And there's a very high risk of severe consequences for certain vulnerable people. And those people are the people that we at the Sanford Center and the UNR DEAR program and you, Annette and Brett, through this series, I mean, these are the people we serve. And so that's why we've launched Nevada Can, was to create, again, a tool to enable older adults to stay home and remain connected while they do so.
So Peter, can I just ask, I'm sure we're going to get some guidance from the governor and so forth as we perhaps start to open up the state in the next weeks or whatever the time frame is, as other states seem to be doing. What would your advice be if it's not clear as to what our seniors should be doing when we start opening things up? Are we free to go out, or would you be suggesting, if there isn't good guidance, that we should still be staying home, sheltering in place?
Well, you know, I certainly would start with the guidance that comes from the governor's office and the Department of Health and Human Services. And that's, I know, that guidance is being developed in consultation with the Centers for Disease Control, as well as public health and medical experts, both here in the state as well as federally. And so the guidance that comes out of the governor's office should be the premier guidance that people follow. My understanding of that guidance as of today is that the current stay-at-home or shelter-in-place policies and restrictions will continue until May 15th. And then after that, they will begin guidance for a phased approach to start returning to normal over a period of weeks and months moving forward. But that as those phases roll out, vulnerable populations such as older adults and people living with chronic diseases are still going to be expected to stay home and stay safe. And it's important that people who interact with older adults and people with chronic diseases also reduce their risk of exposure, because the whole point is person-to-person contact increases risk of exposure, and certain people are at risk of very severe consequences if they get exposed. And so even if and when the governor releases the shelter-in-place order for everyone, whether that's May 15th, June 1st, or whenever that takes place, it's at least my advice as a public health gerontologist and someone who cares about the quality of life and well-being of older adults, that older adults continue to stay home until there's I don't know exactly what the criteria would look like, but until there's a significant change in the level of risk of exposure across our communities and across our state.
So then let's talk about what resources does Nevada Can do? What's available to older adults so that they can stay at home safely?
And I think I'd like to start the discussion about the resources with the idea of reducing social isolation, because I think that's a really critical piece that people tend to overlook. It's easy to focus on food, right? I mean, people need to be able to eat, right? People also need access to medical services, but a lot of times people overlook the need for social engagement and meaningful connectedness in their everyday lives. Social isolation is a very difficult and challenging issue for older adults in normal times. And in times when everyone's being told to stay home, then it's just exacerbated even that much more. So within Nevada Can, there are 3 major action teams that we've created to deliver the tools and the services to enable people to stay home and stay safe and stay connected. And those do include a focus on food and medication, a focus on telehealth, and then a focus on social support. And so Dr. Carson is leading the action team on social support, and I'd love if she could share, quite a bit about what we're doing and the specific tools that exist to reduce social isolation.
I'd be happy to take it from here. And if it's okay, I actually brought some visuals to share. I know some folks are calling in, so for their benefit, I'd happily also talk through what we're seeing on the screen. But for some folks, pictures can speak 1,000 words. So if it's okay, I'll go ahead and share my screen.
Yeah, please, Jennifer, that'd be great.
Great.
This is so important because we're encountering people every day that are really feeling the social isolation. They're doing the right thing, sheltering in place, but going stir crazy without access to people and services. So this is super important. And we'll share all of these slides. We'll send out an email tomorrow, and that'll include whatever slides and other materials Jennifer's already provided me with. We'll make available to everybody.
Thank you. So do you all see my title slide here about the NEST Collaborative? Is that what you're seeing, Brett? Excellent. Okay, so it worked. Yay for technology. So as Peter was mentioning, Nevada Can, we're really aiming to work collaboratively across the entire Nevada Aging Services Network to meet the essential needs of homebound elders across the state so that they can stay home. So we, when we first got the stay-at-home order, the Nevada Department of the Nevada Aging and Disability Services Division, as well as Jeff Klein from Nevada Senior Services and myself, as we started our initial planning, it was always with a longer term view in mind, understanding that elders are considered a real high risk population here, and the elders should really be staying home, even as Peter was saying, once the order is lifted, to look out for the best interest of elders. They should continue to stay home if possible. So we wanted to create the supports necessary, including social support. And so the social support action team for Nevada Can launched a new program innovation called the NEST Collaborative. And NEST is an acronym for Nevada Ensures Support Together. And again, we are the social support action team for the larger Nevada Can effort. As Peter mentioned, we also provide support. We will deliver food, medication, medical supplies, other daily essentials, pet food, etc. Through Nevada Can, we have a delivery team that will deliver supplies to the front doorsteps of elders' homes. We have telehealth services. That's the action team that Peter leads. And then I am helping to support the social support action team, and our program innovation is called the NEST Collaborative. I briefly want to mention that if anyone wants to get connected to these important resources, it is very easy to do so. All they have to do is pick up the telephone and dial 211. 211. Nevada 211 is a wonderful partner in Nevada Can. They provide resource information over the telephone to folks. And what they will help elders or people who care about elders do is complete a very short elder needs survey. And that is how an elder can express which services they need. And 211 will send that information to the appropriate action team, who will then contact the elder to meet that need. Elders can also log on to Nevada211.org themselves. The longer link, the hyperlink for that is www.nevada211.org/seniors-COVID-19-resources/ and that will take people directly to the portal where they can request help. And so 2 different ways for folks to get connected to these important resources: call 211 or go visit Nevada 211 online to complete the elder needs survey. If someone requests social support, they will be referred to my action team. And again, our program innovation is called the NEST Collaborative. And right now we have more than 20 aging and social service organizations working together across the state to help provide volunteer-hosted social support. We really want to help alleviate social isolation and loneliness during this time of social distancing. We understand how psychologically harmful loneliness can be, but it also can have an impact on a person's physical health. And so social isolation isn't just important in terms of meeting your needs for enjoyment, Social connection is a critical component of a person's health and well-being, physical health included. So we want to make sure that elders are staying connected. We also want to ensure that the essential needs of homebound elders are being met. And so as we're providing social support, our volunteers are going to check in with elders to say, do you need anything? Do you need food? Do you need pet supplies? Do you need healthcare services? And our volunteers will make referrals to help those elders, again, get connected to the supports and services they need. But really importantly, we wanted to make sure that this is not simply a laundry list, a volunteer calling with a laundry list of needs, and that it's a one-way interaction, but instead we really wanted to ensure opportunities for mutual support. Mutual support, what we're trying to do is foster virtual communities. Reciprocity is a core component of what it means to be a part of a community. And so this is an opportunity for elders to make contributions and enrich the lives of our volunteers just as much as the volunteers are making contributions and enriching the lives of elders. And so we like to say that it's not just about what Nevada can do for elders, but also what elders can do for our volunteers and for each other. So this is just a list of our partner organizations here. For those of you who are calling in, this is a long list of many well-known organizations across the state of Nevada. They're bringing their expertise, they're bringing their resources, including their volunteer resources to help support Nevada Can. This is a photo. All of our planning for Nevada Can has been taking place via Zoom. This is one of our program meetings for the NEST Collaborative, people from across the state working together to create these very important social supports. One of the things I want to mention is, again, this is about reciprocity and community. Elders are a valuable resource, and Nevada Can wants to tap in to elders as a resource that can help us get through this crisis. Just as much as we understand that elders need community, communities need elders. We need elders in our lives, and the health and quality of any community can be determined to the extent to which elders are playing critical roles. We have to keep elders in community. We need elders just as much as they need us. We also believe that no matter the problem, community is the answer. We're going to work together to get through this crisis. That's why Nevada Can exist, because we understand the important role of collaboration in community. And like I said before, the social fabric of community, if we really want to foster virtual communities, we have to focus on reciprocity as a core component of community and help foster that shared sense of belonging. And so at the NEST Collaborative, we're aiming to cultivate community one conversation at a time. This is a photo of the Nevada Can website. So if you go nevada211.org and you follow the link for seniors, it'll take you right here. This is what the landing page looks like. And all folks have to do is click on that button, request help, and we will get you plugged in to the resources provided by Nevada Can. Specifically, though, for social support, let me tell you, we're offering 3 different programs. They're called checks, peer groups, and tech gatherings. These services are currently available in English. All of our program materials will soon be translated into Spanish, thanks to our partners at Nevada Senior Services and the Cleveland Clinic. And we'll be able to provide these services in other languages based on volunteer availability. But just briefly, let me tell you specifically what these 3 programs entail. Checks, these are calls for homebound elders in community. Our volunteers will provide one-to-one check-in calls twice a week. And again, our purpose is to make sure that we're checking in to meet the needs of homebound elders. So we'll be asking, do you need anything? And providing an important opportunity for social connection. We will keep the same volunteer with the same group of elders over time. So if you become a checks program participant, you will have the same volunteer calling you twice a week for as long as you wish for that service to remain in place. Our volunteers are only assigned up to 10 elders. I shouldn't say only, it's actually a significant volunteer contribution, but one volunteer will have up to 10 elders that they're responsible to call twice a week. And the reason why we're doing that is because we want to foster relationships, genuine relationships. Our volunteers will use the Assess My Needs survey that is part of the Nevada Care Connection Resource Center to communicate any needs that are identified by that elder. Once it is submitted, qualified case managers will follow up with the elder to meet those needs. Qualified case managers. So our volunteers won't be meeting those needs. They will be reporting those needs to qualified case managers who will then triage that elder's needs to the appropriate referral. Our second offering is peer groups. Peer groups, peer is also an acronym. It's virtual places for elders to engage and relate. And that's what we're trying to do. This time of social distancing it does not have to equate with social isolation and loneliness. Peer groups are here to help elders get connected and to draw support from one another. So in this case, we have 5 elders who will be connected with 1 volunteer to form a peer group. It'll be the same elders and the same volunteer for 1 hour a week over time. Our hope is that elders will be willing to share their personal contact information should they wish to connect outside of the peer groups. And we're trying to foster a mutual network of peer support. So these peer groups are available either via Zoom, like we're doing today, or through teleconference technology based on the elders' preferences. And then the final opportunity is called tech gatherings. And here we are providing technical education and connection help. Tech is also an acronym, technical education and connection help, to existing groups of elder friends. So anyone who's on this call today, if you have a group of friends and you want to stay connected, whether you're golfing buddies or a book club or dance partners, or maybe a group of friends that used to love to get together to walk, and now you suddenly find yourselves disconnected, Tech Gatherings is here to help you stay connected. Our volunteers from the Nest Collaborative will help your group of friends get connected either through Zoom or teleconference technology once a week for an hour. In this case, our volunteers don't serve in any facilitation capacity. They are really meant to be your IT source. They're going to help you all stay connected over time. And so those are the 3 different offerings. The whole Nest Collaborative is driven by volunteers at every level. I will say all of our volunteers do go through training and receive background checks. This is a picture of our elder advisors for the Nest Collaborative. The Nest Collaborative and Nevada Can has been developed in partnership with elders who have provided advice and suggestions about how to make Nevada Can and all of our programs accessible, how to make them interesting to elders. So thank you to our elder advisors pictured here, Susan Stewart, Mary Lee Fulkerson, and Chuck McClatchy. They have really, this is a meeting we had as we were developing the Nevada Can website in partnership with elders to ensure that it's accessible to the greatest extent possible. So thanks to our elder advisors for all of the support that they've provided. Just quickly to wrap up, all of our volunteers, they serve in cohorts. So we have teams of volunteers who are all providing the same service. They're receiving support by what we would call more senior volunteers. We call them guides. These are either aging service professionals or really experienced volunteers who are helping to support the team of volunteers in providing service to elders. And it's all about relationships. We're keeping the same guides with the same volunteers, with the same elders over time. And then just to again mention that all of our volunteers receive training. Specifically, what's important to understand is our volunteers have been trained on elder abuse, suicide prevention, cultural competency, how to use Zoom-based technology. They also receive training about effective communication. They receive all of their program resources and reporting. And then once people have completed this 2-part volunteer training, they are assigned their list of elders to support, and then the magic happens. So that is an overview of the Nest Collaborative, which is the social support program innovation for Nevada Can.
Fantastic. Thank you for Jennifer. What a great resource that's been mobilized and made available. And Annette and I had a whole series of questions to ask, but I think you've pretty much answered them. But I do have a couple that I'd like to drill down on. Firstly, for those attendees who are online, who are using a computer, tablet, mobile device, in the chat window, we've put the URL that Jennifer mentioned on the first slide for anyone who would like access to that if you weren't able to write it down. The Nevada211.org Seniors COVID-19 Resources is in the chat window, or as Jennifer mentioned, calling 211. So for attendees who would like to get involved as a volunteer or know someone who would benefit from this resource, how do they get involved? What's the best way? Going to the website, calling 211, or is a...
So for elders who want to receive services, either calling 211 or going to the Nevada 211 NevadaCan portal is really easy. For volunteers, also go to Nevada211.org. And if you go to the NevadaCan portal, what you'll see is a section specifically to volunteer or donate. And you can click the button. If you want to volunteer, you can complete a very brief volunteer interest form. And I hope that your community here today will consider joining NevadaCan as volunteers and providing these supports. If you complete that really short volunteer interest form, there's two options. One is to provide social support as a part of the NEST Collaborative for NevadaCan. The second option is to be a volunteer to actually deliver essential items to the front doorsteps of elders' homes. And so you could do one or both volunteer option. When you complete that interest form, either the Food and Medication Action Team or the Social Support Action Team will follow up with that person who's expressed an interest. If you volunteer for social support, we're going to send you a volunteer application and get all of the important information from you. And part of that is getting consent for us to do a background check if you have not had one done recently, and also to understand your hours of availability and the type of commitment you're interested in making. And then once that application is completed, we start the training process. I'm thrilled to announce, here we are, it's only May 7th, what is it, May 7th? NevadaCan launched April 1st. We currently have 6 cohorts of volunteers and guides mobilized. By the end of the day tomorrow, and we currently have 4, by the end of the day tomorrow, we'll have 6 cohorts mobilized, able to serve up to 450 or 500 elders, and we're continuing to build that capacity. So it's been just a very exciting opportunity to see what happens when we work together. NevadaCan is built on the power of inter-organizational collaboration. And I've never been more proud to be a Nevadan than to be a part of NevadaCan.
What I think is so cool about it is the fact that as a volunteer, you're getting the social aspect of it too. It's a benefit both ways, just like you said. Everybody benefits from this.
Yeah, thank you. I was just looking at the chat window. So Yvonne has kindly put in there the direct link there to request support. And we'll make sure that's in the email that goes out tomorrow as well, as long as the materials that Jennifer had and some other items she provided. So I just wanted to ask, so someone who is needing support in terms of food or medication, so they now know how to reach out. Did I correctly understand that once the senior, the person in need, has been connected with a volunteer, then whatever their request was or needed would be dropped off at their home? Did I understand that correctly? At their front door?
Do you want to respond, Peter? I'm doing a lot of talking.
Sure, yeah, sure. So again, you know, the overall resource of NevadaCan has created 3 different major elements of support. And Jennifer has just gone into detail about the social support element. But we also have the food and medication delivery component and then the telehealth component. And so the food and medication action team is a little different from the other groups because obviously they are helping to facilitate the distribution of food or other needed daily essentials to people's homes. Whereas with social support, we can do it over the telephone or over the internet. With telehealth services, we do it over the telephone, over the internet. For getting stuff to people's homes, it either has to be mailed to them or driven and delivered directly, you know, to them. So what happens is if someone completes the Elder Needs Survey, again, go through Nevada 211 and the Elder Needs Survey that's on there, they provide their contact information, their name, contact information, and then they check the boxes of what they need. If they click food and medication, that they need food delivered to their home, or they need medications delivered to their home, then their name is given to our what's called the Food and Medication Action Team, which again is led by Jeff Klein down at Nevada Senior Services. And Jeff has built a network of providers across the state who are able to then reach out and identify exactly what the person needs and get them connected with locally available resources. So it may be different in different communities in terms of how it actually happens, right? So to your question of like, well, does it get delivered to their home? It's like, well, in some cases, someone's going to drive it out and deliver it to their home, but there are a variety of different ways in which that takes place. There are the county senior services agencies available in each of the different counties who in various ways have still maintained their capacity for delivering meals through the Meals on Wheels programs. There are the food banks that are working in delivering meals to folks. Again, with medications, there are a variety of different relationships that have been created with pharmacies and others to try and ensure that people can get access to medications. There are a lot of new, what Jeff has referred to as pop-up programs or groups that have emerged who are really interested in helping to fulfill this need and have built all new programs and infrastructures for doing that. There is a program called Delivering with Dignity that is a collaboration between the United Way and other local aging service organizations. It was started about a month ago down in Las Vegas. And I don't have the exact numbers, but if Jeff Klein were here, he would tell you they probably, I think over the last month, delivered something like 25,000 meals to people who are in need of those. And they have just this week replicated and launched that program in the Reno Sparks area as well. So there's now a program, Delivering with Dignity, that has been stood up in the Reno community. And that works with different community partners to identify vulnerable clients who need food delivered to them. And then is a part of this larger picture of coordinated effort to get people what they need. So basically, in terms of the food and medication, if I sum it all up, what happens is someone says that they need that, right? And that's critical. I want to take a step back for a second. With all of this, right, in order to access these services, whether it's social support, whether it's food delivery, whether it's a doctor's appointment, people have to tell us that they need those services. People are often hesitant to ask for help. Right? People are very independent, especially here in Nevada. There's this strong sense of independence. But what I will tell you is that this pandemic has shown very, very clearly that we are all interdependent, right? That we all need each other in order to get access to the services and supports that are required to maintain our quality of life. And especially in a time of physical distancing, it's important to stay connected to resources. So it's critical that people not just think, oh, I don't need help, or oh, I'm fine, I got this covered.
I'm gonna sweat it out until the
15th. I'm gonna pull myself up by my bootstraps. My bootstraps are really long. No, I mean, whatever someone's telling themselves, there's nothing wrong with asking for help and reaching out to get connected to these services, even if in quote normal times people aren't apt to ask for this help or don't need help. Right? Some people just don't need help. They have plenty of means, plenty of social connections. But in this time, all elders should be staying home, and therefore all elders need to be asking for the support that they need to maintain connections to all of these resources. And that's what Nevada Can is about. We've created a tool to connect people with resources. So if someone asks for help in getting food, right, then what happens is their name goes to our action team that focuses on food delivery, and then that gets connected to one of our local food, part of that local network of food distributors. And so it happens in a variety of different ways once it gets to the local level. But it could include a volunteer bringing food to someone's home or other ways of just connecting folks with those resources. But we do try to be as responsive as possible, as quickly as possible to people that need that support.
I want to.
So Peter, if I'm an elder in need, I should not hesitate to reach out and kind of think of you guys as a hub, a team who are going to work out how to best address whatever my need requirement is, and you'll work out a way to solve that within reasonableness to make sure I'm taken care of. Is that kind of the gist of it?
Yes.
Just reach out, and then you'll work out what I need and how to take care of it.
I'll say that so behind the scenes, behind the curtain of Nevada Can is a very complicated network of collaborations across the entire state. Thanks to the leadership of Nevada Aging and Disability Services Division and all of the partners who are part of NevadaCAN, we have worked out this very intricate network of how to meet elders' needs. We don't want elders to have to navigate that complicated system. So we wanted to make on the front end a very simple one-stop entry. All that elders have to remember is 211. All the elders have to do is either call 211 or log on to nevada211.org and request what they need. And then behind the scenes, the state has worked really hard to put together this amazing network of collaborations, drawing on every existing resource possible in order to meet the elders' needs. And so what Peter was describing in terms of the Food and Medication Action Team, if I were to draw out the statewide network for how elders are receiving food and medication through that action team, I would have a really hard time doing it because there are so many people involved. The good news for elders is that they don't have to worry about that network. All they have to remember is 211. And on the food and medication topic, let me say that we are not a grocery shopping service. If an elder is looking for a grocery shopping service, they could still go to 211 and find the resource to connect with a grocery shopping service who might be willing to work with you to get you the specific ingredients you need to make something. But with food and medication delivery through NevadaCAN, we're talking about essential needs for food. We wanted, so we will drop off, it's not necessarily tailored to each elder's grocery list, but we are going to make sure that elders have nutritious food, the nutritious food that they need. They may not be able to select what necessarily goes into the grocery bags.
Thank you for clarifying that, Jennifer.
Yeah, and I actually wanted to delve a little bit deeper into the telehealth, because we haven't talked too much about that as far as the services, what's available, how are they delivered.
And why that's so important during this time that we're dealing with, which is going to last for some period of time, as you kind of alluded to, Peter.
Absolutely. And I think, it relates to everything that we've been talking about as well, is that the first thing is that people need to recognize their own need. Brett, you just asked the question, you said, so if an elder is in need, they can just click on this button or log into this website or call 211 and get connected to these resources. And that's exactly right. The challenge is people don't recognize their level of need, right? And so there may be an elder out there who's thinking, oh, well, I don't need help with food delivery because I'm totally cool. My grocery store, they're open. I can still drive. I'm fine. I'll go on out to the grocery store and just get what I need. Well, I'm here to tell you, folks, we discourage you from doing that, because in doing that, you're putting your life and the lives of others at risk. Like, that's the whole point here, is that you may not feel like you're in need. You may not believe that you're in need, but take advantage of these resources because they are here to reduce your risk and enable you to stay home. And the same is true for doctor's appointments. There may be doctors, and I work at the School of Medicine at the University of Nevada, Reno. I work with a bunch of really wonderful doctors, but there are folks who are like, yeah, come on into the clinic. We'll see you, right? I discourage elders and people with chronic conditions from doing that. Take advantage of telemedicine. Take advantage of telehealth, because if you're going into a clinic, you're putting yourself and the lives of others at risk. You may be perfectly capable of driving there. You may be perfectly capable of getting a doctor to see you, but those interactions are a risky situation, and we're really trying to discourage that. And that's why we've created all of these tools, but people have to recognize their level of need and connect in order to reduce their risk, and that's really what it's all about. So in terms of telehealth, we have built an integrated statewide telehealth network to ensure that older adults have access to medical and social service appointments. Let me say first, these are not intended to be emergency appointments or COVID-related testing and treatment. If folks have emergencies, they should call 911. If folks need COVID-related testing or treatment, they should connect with their primary care provider and go to the public health authority, public health department, go to their provider to get that testing and those treatments. This is about the recognition that older adults have multiple chronic conditions and need routine care. And right now, going out in the community to a clinic or to an office to get that routine care may not be advisable. So we built a telehealth network so that people who have their routine appointment that may have been canceled, right, can reschedule that and can get connected. And so there are a lot of partners that are involved. It starts, again, with people checking the box on the needs survey that says that they need a telehealth appointment. And then what happens is their name comes to the Sanford Center for Aging at the University of Nevada, Reno School of Medicine. If they are someone who lives in the southern part of the state, then we connect them with the geriatric assessment program at Nevada Senior Services in Las Vegas. If there's someone that lives in the northern part of the state, then we reach out to them directly from the Sanford Center for Aging. And that's step one, is that we sign them up for a telemedicine geriatric assessment. This is an interdisciplinary comprehensive assessment that includes a geriatrician or a physician specializing in care of older adults. It includes a geriatric social worker and either a geriatric pharmacist or geriatric nurse. And they do a complete whole person assessment to understand the needs of an individual. And once that assessment is done, then we're able to connect them with the other telehealth providers across this network that we've built. So the first thing that will happen is that we will send the results of that assessment along with the recommendations that are in the care plan back to the person's primary care provider. And we'll encourage their primary care provider to follow up with the patient or with the older adult. And if that primary care provider is able to do telemedicine, then they can do that very easily with a telemedicine follow-up to talk about how to implement the recommendations that came out of that comprehensive assessment. If they're not able to do telemedicine, then that follow-up may take place a little bit later once people are able to come back in person to their appointments. But we're still able to connect them with other services if they're needed. So for example, one of the needs that may come up during the comprehensive assessment is some sort of social risk factor or a psychosocial issue or anxiety that someone may be experiencing because of this situation. And in that way, we're able to refer them to social workers who are part of the team, either at the Sanford Center for Aging in the north or Nevada Senior Services in the south, who will then do a tele-social work consult. They'll have a conversation with someone to dig a little deeper, to learn more about what's going on with them, and then to provide some ongoing case management if there's a need for ongoing social work case management. If there are more intensive kind of behavioral or psychosocial issues going on, then we can refer people from that general social work consult to a licensed clinical social worker who can actually do psychotherapy and psychosocial counseling on an ongoing basis. So there's multiple levels of intensity then in terms of dealing with the psychosocial issues that come up. Another resource.
Can I
Go
just
ahead.
ask, how are these services paid for?
Great question. I was going to get to that. So we do bill people's insurance, right? So several of the services are available for free because of grants that we receive from the Nevada Aging Disability Services Division, the Department of Public and Behavioral Health, and other federal funders. So for example, those social work consults that I just talked about are largely grant funded. But for things where there are billable services that are available, we bill people's insurance. So most of the elders that we see are on Medicare. Some are on both Medicare and Medicaid. Some are on Medicare with Medicare Advantage plans. Some are on other insurance, have other forms of insurance. But we work with them once we sign them up for these clinical services to identify, where they get their medical care covered and how we can bill for that. And so in terms of like out-of-pocket costs, co-pays, it would be the same types of things that are typical for any given person in terms of their routine medical visits. So if someone has co-pays, then they will still have co-pays. If someone has out-of-pocket costs, they will still have out-of-pocket costs. Each person is a little different in terms of their insurance situation. So our clinical operations team really navigates that with them. So the other services, though, that are available, once someone goes through that comprehensive geriatric assessment, if there is an issue related to dementia or Alzheimer's disease, then we're going to send a referral to the specialists at the Lou Ruvo Center for Brain Health at the Cleveland Clinic in Las Vegas. And they are funded and are able to deliver telemedicine services for dementia assessments and treatments for people dealing with Alzheimer's disease. We also have partners who are connected and able to deliver occupational therapy, physical therapy, and speech therapy. Down south, that's a group called Accessible Space, as well as Nevada Senior Services. And up north, we work with a group called the Continuum, who are part of this broader telehealth services network. We're also able to make referrals to telepsychiatry. So if someone is dealing with really sort of severe mental illness kinds of situations, then our social work team or our geriatric assessment team might connect them with a psychiatrist. So the UNR Med Department of Psychiatry is part of this and able to deliver telemedicine, as is other groups around the state, or as are other groups around the state. And so in this way, you can see we've really built kind of very rapidly an integrated telehealth delivery network. It starts with someone saying they need help. So for example, if they had a routine visit they missed and they would like this assessment to help them manage multiple chronic conditions or cognitive impairment, then they come in through our comprehensive geriatric assessment. We then connect them back with their primary care provider, or connect them with telesocial work, teledementia, telepsychiatry, tele-OTPT. If they do not have a primary care provider, then we're able to help to find them one. The UNR Med Internal Medicine Group is a part of our network and is able to enroll new patients to be seen via telemedicine with the primary care provider. We also are working with the Nevada Primary Care Association and the network of federally qualified health centers with Nevada Health Centers and that network that are part of the broader landscape of primary care providers really in every community around the state, including our rural communities. And so we've sort of built, in a sense, new connections between already existing providers. And we've built a mechanism for helping people flow between those different providers. Similar to what Jennifer said about the food distribution, there's a complicated network of providers behind the scenes, but we have just tried to create a tool and a portal for people to access that network and to flow between the different elements of that network without them having to worry about it, right? Tell us you need help and we will reach out and we will get you plugged in and we will get you these services. That's basically what it comes down to. And ultimately, by enabling people to maintain routine visits, to get geriatric assessments, to reduce social isolation, to get food into their homes, we have created a system through Nevada Can, again, that enables all older adults, all elders in our community to stay home, to stay safe, and to stay connected to the resources they need to maintain their quality of life during a global pandemic.
Very well said. Yeah, oh, amazing. I can't believe the services that you've made available in such a short period of time. I'm just looking at the time, it's about 10:48. Would you guys be up for hanging around for about 10 minutes and just taking any questions our attendees online might have?
Of course.
I'll have to open that up. Great. So for anyone who is listening and would like to ask either Peter or Jennifer a question, you can raise your hand on the Zoom interface by clicking on raise hand, or if you're called in via a phone, pressing *9, or alternative, if you'd like to just type in your question, if you click on the Q&A box, the little icon, you can type in your question and we'll direct that to Jennifer and Peter as appropriate. And just while we're waiting for people to do that, I just wanted to quickly just put up a quick poll just for our upcoming seminars for anyone who might want to attend. So let me just do that quickly. So for those who are online, you should see a pop-up that's just giving you the ability to register for one of our upcoming seminars. We have another workshop this coming Tuesday on decluttering. And on May 14th, we have a telehealth webinar with Dr. Tracy Bionde from Prominence Health Plan, talking similar to what Peter covered, but some other different aspects of that. And then on May 21st, we have a webinar on making sense of your finances during and after the pandemic with a financial advisor. And then on May 22nd, which is a Friday, not our regular Thursday, we have our main seminar as a webinar, The Truth About Cannabis for Seniors. So if any of those are of interest to you, just click on the appropriate selection and we'll make sure you get registered, and then you'll receive a confirmation email with the details on how to access that webinar. So I'll just leave that up for a moment, but we have, let me just unmute. So I'm not sure if that's Dawn or Jean. Did you have a question for?
Yes, I do. For either of your presenters, they've been wonderful, thank you. I have a wondering, the volunteers that do medicines or food, are they expected to be a charge? And I would assume the psychiatry and doctors would have a charge. Is that correct?
Right. So again, two different buckets there when you're dealing with the food or the telehealth. On the telehealth side, we have convened and coordinated a network of providers. All of those providers are set up and have contracts with a variety of different insurance companies and payers, which is how we refer to them. So when a patient signs up for these services, each of our providers that are part of that network will work with their insurance company to be sure that the services are covered.
Great, thank you.
And if someone has co-pays and out-of-pockets, you know, everybody's insurance is a little different. So we figure that out for each person, and we work with them to be sure that the services are covered. If there are people who are uninsured, then they should still reach out to us for help, because we have partners who are able to see uninsured folks, and we have resources that can help people navigate how to get insurance and how to get connected with these kinds of things. We're not going to turn anybody away. We may have to explore some other options depending on the situation. And for the food and medication, delivery, there are no fees associated with that. That's all set up so that people can get access to resources without charge.
I will add to that if there is a way that any recipient for food can actually contribute to the greater good, even though we're not charging for delivery of food. If somebody wants to make a donation to Nevadacan to help other folks also be able to receive food, there is a donation portal on the Nevadacan website, and so people have been donating toilet paper, essential food items, and whatever folks want to deliver. Please feel free to do so through the Nevadacan donations portal. And so while there's no exchange of money for food, there's definitely a way for people to give back to help support this initiative. On the medication front, the Food and Medication Action Team will work with each person on an individual basis to figure out which pharmacies are in their area, and try to help with the delivery of that person's medications on a person-to-person basis. And so in that case, I think people would still be paying for their own medications. It's not a way to receive free medications, but what our volunteers will do is help make those connections so that you could get your medications delivered to your front door.
Thank you very much. You both answered way and beyond the question. I appreciate that. Thank you.
Great question. And so just on that, Jennifer, just for my interest, if we wanted to donate food, we can go online, go to that form. Is it somewhere nearby, or are there multiple drop-off locations? Do you know how that kind of works for anyone who's curious about what that
yeah,
would
the
look like?
Nevadacan Food and Medication Team, led by Jeff Klein of Nevada Senior Services, is working with representatives in every county across the entire state, as well as some of these pop-up food delivery organizations to figure that out. And so in every single county, there is a location that will receive food donations. For each county, it may be a little bit different. But know that if you make a donation, if you're interested in making a donation, just go on to Nevadacan, click the button, and it will ask you what you're interested in donating. And if it's something that would be utilized for the Food and Medication Action Team, they will call you and follow up with you to give you the specifics about where to drop off that donation.
Wonderful, thank you. Let's just see if we have any other questions. You guys have been so thorough with such great information. I think you've certainly answered our questions. So I don't see any more questions, but I know sometimes it can be challenging to work out how to raise your hand or ask a question. So I'm just going to unmute everybody if you guys are okay with that, in case anyone does have questions. So I'm about to unmute everybody, so just stay silent unless you have a question, but if you do, please feel free to speak up.
Brett, if I can, I think there was a question raised by Yvonne that came in, and they may have just come to me, but she was asking, can a family member or concerned friend request Nevadacan help for an elder? And I think that's a great question. And the answer is absolutely yes. You know, that is why we built the portal in the way that we did, is that not only can an elder go on by calling 211 or going to the 211.org, but any person on behalf of an elder can complete the elder needs survey. So, for example, there may be an older adult here in Nevada whose daughter lives in Florida. And maybe this person, lives in Ely and doesn't have access to the internet, but their daughter lives in Florida and they learn about Nevada Can. Well, that daughter in Florida can go online, fill out the survey on behalf of their mother, and then that person would get connected to the whole network. So really anyone can fill this out for anyone else in terms of the, helping us to identify and recognize their needs.
And we'll always follow up with that person when we get the referral to ensure that they actually want the help.
That's right.
So it's not like we would just be surprising them without making that important connection. And so we have volunteers, for instance, for social support, and this has happened where a very concerned neighbor or family members like, my mom would really benefit from social support, and they complete the Nevada Can Elder Needs Survey, and we call, and mom or dad saying, no, I'm okay. And that's great. That's great. They have turned it down, but at least they have the opportunity to get connected. And we wanted to make it really easy for people to have that option.
I'm sure you've probably experienced the opposite as well. You've contacted the elder and then they've been receptive. That would be helpful. Thank you. I'm glad you called.
Yes. Yeah.
Oh, absolutely. Absolutely. And I just want to say again, on the issue of social isolation and social support, I think a lot of people don't recognize their need for that, right? Older adults are not running into their friends and their neighbors in the same way that they typically would when they're able to go out into the community, if they're staying home and following the direction that is being very strongly given to them to stay home to reduce their risk, right? So there may be someone out there thinking, oh, well, I'm okay. I'm going to connect with my friends for bridge next week anyway, because none of us are sick, right? And that's the kind of thing that we're saying, don't do that. Stay home. Don't go to your weekly bridge game with your neighbors, right? And that's why this social support resources of the NEST collaborative as part of Nevada Can are so important, because people may not realize that they're at risk for becoming socially isolated, but there is a reduced opportunity for people to connect with others, which they normally do just kind of in their routine day-to-day life, but that's not there right now. So reach out and tell us that you want to have someone give you a call and check in. Tell us you want to be a part of one of these peer groups, talking with folks, because it's just a huge opportunity people should really be taking advantage of, even if they're not quite convinced they need it.
And maybe you don't feel like you really need it. It's your opportunity to contribute to someone else's life. Like, be part of offering a network of mutual peer support. And so maybe you have all kinds of social connections with your family every day, and that's wonderful, but this is an opportunity for you to play an important role in the lives of elders who may not be as fortunate. And so, this is all about reciprocity and community. And if you have the space in your life to be a friend to some other folks who may be feeling really lonely, contact us at Nevada Can, become a part of the NEST Collaborative. We're getting ready to reach out, and we're working with Jennifer Williams Woods, who is the Nevada State Long-Term Care Ombudsman, to extend the reach of our NEST Collaborative social support opportunities to all nursing home, assisted living, memory care, retirement living, residential care facility elders. If they are isolated in their own rooms and completely disconnected, many of them from their families. It's a horrible situation, as you can all appreciate if you have looked at the news. Residents in residential care communities need our help. If you have concerns about residents in long-term care communities and residential care communities, this is your opportunity to help those people. Join us, either as a program participant or a volunteer. It doesn't matter which way you come in. You're coming into a NEST Collaborative, and you have a meaningful role to play in helping people who are less fortunate than you. We need you. Residents in nursing homes and assisted livings need you. So please join us.
Thank you, Jennifer. We've just come up on 11 o'clock. And so just on behalf of all of our attendees and Annette and myself, I just want to thank both of you, Jennifer and Peter, so much for giving up time today on this really important topic and sharing such great information with us. Again, we'll get an email out tomorrow with all of the resources that Peter and Jennifer have referred, and the links and the phone number for anyone who missed that. And if you have any questions, don't hesitate to contact Annette or myself or 211. Whatever you need, just reach out, please. Or if you know someone who needs help, please reach out and make sure people get what they need during this time. So again, thank you both so much. Thank you for everyone who's been on the webinar today, and wishing everyone a wonderful rest of the day.
Thank you.
Thank you so much.
Thank you very much.
for
Appreciate
having
the
us.
opportunity.
Oh, our pleasure.
All right. Thank you. Bye.